The Factor Care podcast is not sponsored. The use of information on this podcast or materials linked from this podcast is at the user's own discretion. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Thank you for your support as we attempt to bring more awareness to chronic illness and information to improve the quality of life for patients and their families.
Thanks for joining us on another episode of the Factor Care podcast. You're here with me, Stephen Lee. We have Josh Hawkins, and today we have a guest, Matthew Hsu from MicroHealth. And before we get started, I just want to let everyone know that MicroHealth is not sponsoring this podcast. We are handling it just because it's an app that I use personally. I feel that getting it some notoriety will be beneficial to the community. Matthew, tell us about yourself and tell us about MicroHealth.
Yeah, absolutely. Thanks so much for having me on, guys. Great to be here and love the podcast. So my name is Matthew. I help lead product development at MicroHealth. So it means I'm responsible in part with our engineering team for fostering the development of our patient mobile app, our web dashboard for healthcare professionals, and all other parts of the product experience. I've personally been with MicroHealth for a little bit more than a year. I started at the start of 2023, but MicroHealth has been a part of the hemophilia community for far longer. We were originally founded in the early 2010s, actually, by a patient, someone who had hemophilia A, and a healthcare professional, a pharmacist at Columbia University, who's also a medical researcher, who was doing a lot of research at that time, particularly around texting solutions, figuring out how, in the early days of smartphones, we could use SMS and texts to help patients be more engaged with their care. So he was friends with this hemophilia patient. They felt like there was a really great opportunity to help support the community and help make a lot of the day-to-day management of the condition easier. So they came together, built a platform, and over the 10 years, it's gone from simply just a texting solution to a much bigger ecosystem of patient caregiver mobile application for smartphones, that web dashboard that I've talked about, and then a number of other data offerings that we've been trying to use to really help research and other efforts. So happy to dive into more details, but it's been a long journey and an exciting one.
Well, let's go into how has the app helped patients in general?
Yeah, I think from the inception and through to today, we've kind of had the same mission, which is really to make managing hemophilia as easy and as seamless as possible for everyone who's involved in that situation, right? So on the patient side, the core purpose of the app is to really help facilitate reminders, logging, tracking, and all these other components of your health that historically might have been scattered in different places. Maybe people are logging on paper. Maybe people, sometimes forget to either take their medication or to log that they've taken it. So our goal there is really to make it effortless. And then kind of the second core piece of the platform is really to connect patients with their healthcare professionals more seamlessly as well. So instead of, you might get a text or a call from your healthcare professional every so often, go into clinic. But we know that there's a lot of time where you might just be at home managing your own condition. You might have questions come up, and the app is really there to be a companion to help with messaging, communication, and really kind of around-the-clock monitoring to the extent that it can be useful.
Yeah, that's interesting. You mentioned it's a companion because that's exactly what it is, right? And I think a lot of people don't realize that it connects you to your HTC and or your healthcare providers in general because it reports back to them. And I believe that's an option. Not everyone has to do that. But
Yep, exactly. And actually that optionality is another kind of core value that we're really interested in, right? We know every person with hemophilia is different, has different goals for their life, has different ways that they manage it. And so we want to be able to support that entire kind of diversity of lifestyle and of needs by giving people the tools, but also allowing them to personalize. So on the HCP side, for example, while you can message, you don't have to use MicroHealth for messaging. We know other doctors have, the EMR that they use. We're focused on really just providing those tools and the ability to do what you want while again, making things as kind of automated and as not manual, not kind of burdensome as possible.
Yeah, I mean, as far as messaging goes, I'm gonna be. I don't. I mean, obviously, this is a sample size of one, but the hemophilia center, at least in New Orleans, I want to say they almost respond faster to my MicroHealth messages than they do to my phone calls. So
I've heard that before.
Yeah.
And this is interesting for me too, Matthew, because Stephen and I have talked about this application that you guys have for a long time. I know when I do my annual clinic checkup at Tulane with the HTC there, it's something that comes up, at least from the pharmacist, each time I'm in there. So I've been doing, we thought this would be a good idea too, because Stephen's been using it for such a long time and I haven't. And so I have a whole lot of questions in my head. I want to go through the things that are most vital to getting you a chance to explain what's going on. But I know you like it a lot.
Yeah, I mean, I like it a lot, but I didn't know if you wanted to share on its functions or its functionality now, or I mean, I can go into my own testimonial. It's up to you, Matthew.
Yeah, I'd love to first share my screen a little bit. Actually, since you guys are so gracious and welcoming us on, I was thinking I could actually share an upcoming version. So we'll give you a sneak peek.
Oh, wow.
That'd be great.
As to
So
some
you're
of
going
the
to see it
updates
here
that are
first.
coming up.
All right, nice.
This is
Yeah, so you'll see
breaking
it here first.
news.
So I'll just share my screen right now, and then we'll get into it.
Sounds good. Let's do it.
Let me know if y'all can see
I see it.
screen.
Yeah,
Awesome.
We're good.
So yeah, this will be a quick disclaimer that what we're looking at right now is actually an upcoming version. We're making some exciting visual updates, and I'll also call out some of the new features that are coming in the app. We're constantly, obviously, trying to make the app better. I'll probably repeat this before we end the podcast, but we'd really welcome and encourage any feedback from folks in the community who might have ideas or suggestions or feedback for how we can be better. We're fortunate to be in a position where we really want to invest and continue making the app better. But what we're looking at now is the updated notification screen. So basically, when you first join the app, you're asked to share, what treatment you're on. We'll ask you, the reason that you're taking a certain medication, what your typical dosage is, what days of the week or what schedule you take your doses on. And that can also vary between weekdays and the weekend if your lifestyle changes between those two. And then we'll actually go ahead and send you push notifications on your phone that help remind you when it's time to log, when it's time to infuse or inject, all kind of in that theme of making things more frictionless. And once you do click a notification, you'll get to this screen. We're looking at my test user, Matthew April, and you can see all the different options here that are available for logging, right? So you can log your medication. If you have a bleed, you can log that. If you skipped a dose, you can log that here as well. And if you want to be reminded later, maybe you're in the middle of something, but you don't want to forget to take your infusion later, you can click later as well.
So that's the new step, because before we didn't have an option for later, right?
Yeah, exactly.
Currently, we don't have an
we
option
know
for
that life might change, and sometimes people's phones are blowing up with notifications. So we want to find that right balance.
Nowadays with more and more people being on multiple therapies, that medication option is great too, because you may not necessarily take the same medication every single time you infuse.
It's true.
So that's a good one.
Yeah, that's a newer thing that just started. Go ahead, Matthew. We're not trying to cut you off, but we're just going to keep.
No, it's great points. We at the start of last year finally rolled out a much requested feature to add multiple medications, each with their own schedule. And we know some folks are even using it for non-hemophilia medications too. So if you just want to remember every time you take, say, Advil or something else, we support that kind of custom medication addition in the app too.
I had no idea.
Go ahead first, and we'll go ahead and see what the sample log looks like.
Okay.
So when I hit medication, actually, you just saw that my camera came up. So that's one feature that I wanted to first mention. At the bottom of the screen here, you see there's a button that says Scan Product. That's a feature that I know some users might not be aware of. But basically, this is an easy way for logging. If you don't want to just enter in the features on the screen, you can actually go ahead and scan the QR code or a barcode on the product. We have a really rich library where we're able to read that code. We can pull in things like expiration date and lot number for the medication, and that'll automatically get saved in the database, and it will update directly on the medication screen here. So you don't have to enter something like lot numbers manually.
That is awesome.
Yeah, and I mean, I think it's mandatory now that all the pharmacy products have a QR code on it. So
It's just a great way to simplify the whole process. So it speeds up a lot for the patient. It makes it a lot more accessible and easy for someone like me. Yeah. I would do that. That point right there makes a big difference. And I'll say more in a minute, but I'm gonna let you keep going. I don't cut you off.
Yes, perfect. I'll highlight a few more things and then we can talk about it. But anyways, we're really excited about the lot number piece, particularly. We know that sometimes recalls happen, and we've actually been able to reach out in the platform because we know certain users took certain lot numbers and give them a heads up. And that's information that is kept very secure between the platform and the users, but can definitely help from a safety perspective.
That's great.
So I'll go ahead and save the infusion here. See if we get that success modal. And then I'll show you guys a few more things. And then again, we can talk a little bit more about your specific stories. One thing I want to highlight is kind of the ability to look backwards at your logs. So not only you're getting these reminders every so often, remembering to infuse, remembering to record that, but over time, as you build up logs, in this calendar view, you can go back and actually see how your activity has been. So the blue dots here count for an infusion. The red dots indicate a bleed. And if I go back farther, you'll be able to see that there's other things that we can log, like notes or those skipped events in those other colors. Nice. But as you build up kind of this logging history, we know that you probably want to be able to share this information with your professional or with someone else that's involved in your care, right? So if you go ahead and tap the top button in the right here, you can actually have an option to send an email with your logs to any email that you want. So even if your professional isn't on the MicroHealth web dashboard, this is a great way to be able to get them that information. Basically enter in the email that you want to send it to. You can choose any time frame that you want to include of the data. So let's say I've been using it for multiple years, but I just want to include my 2024 data. I can go ahead and do that with the dates, send, and then a PDF will arrive in that email that will include all of my data. So you'll get the calendar view, you get additional information about each log, and we know that can be really helpful not only for nurses and hematologists, but also pharmacists who might need to be helping with insurance coverage and other situations like that.
Yeah, I think that's important because even if your HTC may not be have some kind of joint venture with MicroHealth, if you were able to email it to them prior to your annual visit, I mean, they'll have the log right there in front of you. And I've seen the logs. They'll even do bar charts and things of that nature to see, if there's any kind of months that you had to use more or less, or just getting a snapshot of how the year is going, and I mean that's beneficial to both the HTC and yourself, and being able to do it so quickly through an app. That's awesome.
Yeah, I think it's great. I'm gonna keep going, Matt. I want to hear more.
Perfect. Yeah. So I think that's a good transition into maybe the care team side of things, right? So obviously, our ideal is for HCPs to be able to join the platform as well. And so if they do, you'll see you can connect directly with your healthcare professionals through the platform. When you opt in for monitoring, basically the HCP is able to see in real time kind of all of your different activity in the app, how you're staying adherent to your medications, any bleeds that you might have logged, any skipped events. We also have a notification system set up for professionals. So, for example, if you do report a bleed, professionals can get an email immediately upon notification. And we know some centers like Louisiana will actually reach out kind of as soon as they get that email, checking in that everything's okay. Other practices might not check in immediately. That's totally fine, but they have that information and they have those details right on hand, so that the next time you have a conversation with them, it's something that's really easy to refer back to.
Okay, well, I can tell you right now.
We also do support messaging in the app, like we talked about before. So if I go ahead and hit new message here, you'll see I have direct messaging history with my provider here, Michael Scott. I can ask him questions. He can check in proactively as well and see how everything's going.
I was gonna say that Michael Scott pick and that right there, I'm gonna download the app in a minute. I appreciate that. That makes it for me right there. I'm good.
Well, I can attest to the messaging. It's at least with the HTC that we use, they're on it. I mean, they must get it immediately because the same day I'll log a bleed, which I rarely ever log a bleed. I'd get a phone call within hours saying, "Hey, Steve, I noticed that you logged a bleed. Is everything okay?" They'll ask me questions. Do you need to come in, get a scan done? Do we need anything? I mean, it really helps the healthcare system uh, work on things immediately, because in reality is a lot of our damage to our joints and whatnot is going to be intensified by how late you treat it. So being able to have access to care a lot sooner than later, I think it's awesome. I mean, and that being a function of the app is great. And I hope more HCCs join on the bandwagon. I don't know if it's in other disease states. I don't know if y'all use this for other things, you know, whether people that get consistent medications that need monitoring.
Well, he was bringing up that the ibuprofen or Advil. So I mean, I would think that it probably does, but we'll let you keep going, Matthew, and we'll let you finish explaining, because you're probably going to answer a lot of these questions anyway. But yeah,
No, these are all great things to bring up, and it's always helpful to kind of remember, like, okay, the function and the features exist, obviously, but what's the deeper why, right? And Steve and I like that point you brought up about kind of time being of the essence, right? Really, the faster we can facilitate these things and not have to rely on our own memory or things like that, certainly the better. And we want to support people logging and taking care of their condition however they like, but I think having tools like this that can really take things off your guys' plate is really, really important. Maybe the last thing I'll highlight for now, and then we can kind of go over to your guys' story, is on the kind of safety and privacy side, right? So we know that data privacy is always a really big kind of concern and a question for people, and at MicroHealth that is sacrosanct. All of the data that is shared in the app should be for patients' use and for their benefit. When you do connect with an HCP for monitoring, for example, we have an additional consent step that makes sure that you understand that you're providing access to the data to that professional. You can revoke that access at any time. HCPs are also kind of told and enforced through our privacy policy the conditions under which they're able to use the data. And then obviously we know in hemophilia there's other kind of important engagement with pharma and industry as well, right? So in kind of response to some of the questions that we've gotten, we recently, at the end of last year, released something that we call the Trust Center. So the Trust Center is really all about privacy, and the purpose of it is to give folks even more control over, how their data might be used, how they want it to be used, and what kind of opportunities and engagement they might have through the application. So every MicroHealth user is asked to go through the Trust Center, and there are kind of three overall categories where we're helping give people a little bit more control. So the first is medical research. Obviously, there's really important hemophilia data registries, and the data that we get in MicroHealth as real-world evidence is really valuable and can help contribute to medical research. But we don't want anyone's data to be used for medical research unless they explicitly are interested in that, right? So if you are open to having your anonymized data from the app contribute to different research studies, maybe product specific or maybe broader, you can opt in for the setting. Personal identifiers are never shared, but still, even then, if you don't want to be involved in that, you can go ahead and turn this off or turn it on, and these settings can be changed at any time as well. The other two privacy things that I'll quickly highlight, we have a setting around surveys and clinical trials. So if you're interested in, maybe participating in market research surveys where you can get compensated for your time and for sharing about your experiences, you can opt in or opt out to that setting. And then lastly, if you're interested in receiving more sponsored content from manufacturers about certain products, you can opt into that, or you can opt out if you would prefer to not kind of get that sort of information on your timeline. As a company, we're totally product agnostic. So basically every hemophilia product in the market is loaded into our database, and we are open to and really think it's important to kind of support that entire breadth. But we do have some partnerships with companies that help keep MicroHealth alive and help us to continue improving the app.
Quick question, Matthew, on the surveys and clinical trials. So is it when you're doing that, are you guys just relaying out the information as it comes into you, or is it specifically customized to whatever the patient that's using the application to their state? what they're dealing with?
Yeah, so if someone opts into the surveys and clinical trials, we are trying to make everything as relevant as possible for the
Right.
user. So yeah, there might be instances where we could in the future send out opportunities for market research where maybe a company wants to just interview anyone who has hemophilia. And again, all these opportunities would be compensated for our users. But in some instances, it could be all users. But in some instances, maybe they're only looking at folks with severe hemophilia B. Or maybe they want only
So you
focus
know
on
our
certain
demographic?
products or certain
Yeah, no,
sectors.
no. So that's why I'm asking is because we get specific emails and reached out to. Steven and I are both uh, severe Bs, so that's why I was asking, because I didn't know if it was just like, okay, you guys gather the information and it goes out to all of the hemophiliac patients, or if it's specifically designed for that. And I'm just, either way, we're good. I think it's a great option to be able to get that information. So I was just curious if it was customized based on whoever's using the application and their state.
Yeah, great
No,
question.
you
Yeah,
answered
it
you
is.
answered
It
me
is
already.
customized, but there's some instances where it might
Yeah.
go beyond just a single disease state.
No, that's great. That's
More
great.
more of a comment than a question, though. I wasn't familiar about this trust center, but now that seeing it, I applaud the transparency that MicroHealth put in to let us know, like, hey, uh, whether this is how you fund your app or your software is by selling data and whatnot. But hey, we're giving you the option whether you want your data to be out there or not. It's going to be anonymous, and you take control of basically your HIPAA information or your personal information and control how it's used. I mean, I think that's wonderful. I think more companies need to be more transparent. A lot of companies will usually hide that under, paragraphs upon paragraphs of fine print, but this is up front and center. One of the 4 or 5 major tabs on the settings list, I guess you could say. So I appreciate that.
No, it looks good. It looks good. Are you fit?
we-
I don't want to start cutting in on you. I got a lot of questions, and I know Steven and we've got a list of different ones we want to hit you with, but I want to let you finish before we cut in on you.
I think this is great for now. I'm happy
Okay.
to stop sharing my screen for a bit, and we can get into the questions, and maybe
Yeah.
we can bring things up if they become relevant again. Yeah.
I have one. I don't want to cut you off. I'll interject real quick. How many users do you currently have, like hemophiliac patients, using the application at this point?
Yeah. So all time, we have almost 12,000 people who've joined the platform. More, actually, a little bit more than that. And then I'll say in the U.S., kind of all time, we've had more than 7,000 people who've joined the platform. Yeah. So in terms of kind of overall reach, we're not just in the U.S., although the vast majority of our users are in the U.S. But really, we haven't done too much marketing of the platform. I think when we started, the core team and kind of our founders were really involved and still really involved in conferences and whatnot. But we really generally rely a lot on word of mouth and kind of support through that. And we're definitely proud of how long we've been able to stay in the space. I know lots of apps have kind of come and gone over the years, but for a decade plus, this has been a really important mission for us and something we're lucky to kind of help still continue to be involved in.
That's great.
Well, for me, my personal experience with MicroHealth has been great, but just to rewind it back, I mean, we came from a time that we had paper logs. I know you're still using paper logs, but I remember they used to give us log sheets when we'd go to appointments, and I would just peel the label off the vial I use and just slap it on the log sheet. And pretty much when I ran out of pages, I stopped logging. And then, went to handwritten logs. And at one point, I was promised like what do they call those? A PDA, like a little Palm Pilot with another app. And they signed me up for the app, but they never gave me a Palm Pilot, so I never used it. And then when this one was brought up, I mean, this is after, nowadays everyone has a smartphone. Most people are on the Android or Apple platform. I joined on. I'd like to say I was an early adopter, but I don't know. I've been using it a while. But I mean, it has made me keeping my logs a lot more consistent. It's also made it effortless to keep the log, because a lot of times I'd give myself a shot, and when I was younger, I was tired. I usually did it after I was done with school, after I was done with everything I had to do. That was the last thing on my agenda for the day. Give myself a shot. I'm tired. I'm gonna just end the day at that time. And now it's so easy. It's I pick up my cell phone. I have the MicroHealth text message. pinned to my favorites, I guess you could call it. I think you could pin things down, and I just click one and it logs it. Yes, it could be better. I can actually be putting it in the lots that I'm using, but I think just a log is better than nothing. And maybe I'll be more proactive going forward and actually putting in my actual lot numbers. But when I go to the HTC, they have my logs already. They sit there like, hey, Steven, you don't necessarily have to print it out. We have it. When I have a bleed, they know and they offer help almost immediately most of the time. I have had instances where they said, oh, well, it came in late in the evening and no one was on call, I guess you can say, at that time on a Saturday or whatever else. So I didn't mind because it's just my pro fee or whatever else. Mm-hmm. But I typically don't do my infusions till 10, 11 o'clock at night. But at the same time, as a B severe with a long-acting product, I'm able to give myself factor at random times, and it can still cover me for the majority of the time. It's not like some of these shorter acting products, especially for your hemophilia A patients that have such a short half-life. They want to do it in the morning where they have the most coverage while they're active. Like, I don't have to consider that. So mine's usually 11 o'clock at night or 10 o'clock, but sometimes I forget and I get a text message. I'm about to go and jump in the shower or something. I get a text message like, hey, have you infused today? I'm like, oh, let me do that before I go. And I go downstairs, I give myself my infusion, and I do it. So I think the reminders or clutch, it comes in, it helps. I'm pretty good at being compliant, but on those times that I don't remember, it's a nice to having to remember. And I mean, I think anyone that has seen my records can attest. I mean, I'm pretty consistent when it comes to that. And the whole reason we wanted Matthew, you and the MicroHealth team to get recognition of the software was because, I mean, it's helped me be so consistent. I can hope, if someone's not on it, maybe this is something that they can look into from being able to, for instance, even this weekend, I knew I had to get a shot on the 4th. I knew I had to do it, but within my busy day, I forget. I get the message. I'm like, oh, I forgot. I need to get myself shot. It's a weekend. I'm taking the family out, brunch and everything else, and activities. And by the time we get home, we're so tired. But I get the reminder. I did it, but I didn't get to log because of circumstances that night. I didn't log it, so I logged it the next day, super easy, by clicking one on the text message. It logs it, but then I was able to go back into the app and adjust the date. And that's another functionality, is that you can adjust the dates. You can tell it what your dosing schedule is, and it keeps me. I'm on a 10-day regimen, typically easy. So let's say I gave myself a shot on the 4th. It'd be the 4th, the 14th, and the 24th, which is super easy for me to remember. But at the same time, is on those months that we have 31 days, then it'll shift by a day. And it'll just give me a text message on the 3rd next month, like, oh, well, it's I'm shifting the day of the last number that I'm focusing on, So I mean, it's been a great product. I like it. I've used it for many years, and I'm glad that y'all have kept it running and constantly updated it and made it better. And yeah, I mean, if anyone's not on the app and they have hemophilia, I really think you should get on the app. I mean, it's personal opinion, not paid for by anything by MicroHealth, but it really is. I mean, it's 2024. Paper logs. I mean, that's Josh. You might want to get in on the time.
Wait, so Matthew, let me give everybody an update. Steven is like an infomercial for you guys. Like when I'm going to lunch with him, he's constantly, every now and then, not all the time, but it's funny because it's like, and wait, there's more. And so like when we're talking about your application, it's like there's this whole list like he was going through. What year did you start?
I don't know when I started, but it was pretty early, because I remember, I mean, it's been many years. I don't know how long. Yeah. I mean, you said it's been out for 10 years, you said, but it's been many years, because whenever Tulane started it, that same year. Because they brought it up to me, hey, Steven, this, that, and I was like, what? I don't have to save the little stickers on my bottles anymore. Sign me up,
Well, you're making it sound like I'm using real stone tablets at my house, but the reality is I'm not using hard copies. Like, I'm using my phone, and my wife and I just share the notes that way.
Okay.
So if I do the exact same thing that he does, Matthew, or what I do is it usually, like last night, it was probably about 11:30 last night when I infused. Mm-hmm. Now, I'm on and I think too, it probably would help someone more like me than it even would you, because I want to go back to something else you said, but my prophylactic schedule is 3 days a week. And then I've recently had a knee replacement in the last 6 months. And so I'm still on that schedule as I'm going through physical therapy. But you're saying that it does, we do sound like an infomercial. You're saying that it does send you, the application sends you an update or let you know like, hey, you need to infuse?
Yeah, so I get a text message pretty much every single day on my infusion day, and I could probably pull it up on my cell phone. I mean, it won't see it, but literally Saturday, it says, hey, have you infused today? Respond 1 for prophy, 2 for bleed, or 3 for skip today. And it has a tip. To be reminded in a few hours, text back later. Which, honestly, I never looked at the tips. So I never realized it just said that because I just know I look on my cell phone, on my watch, and I'm like, oh, it's shot time. And I pretty much try to get to it as soon as I get the text, which is consistent with the time that I normally stick myself anyway, because it's usually in the evening when the kids are at bed and I have time to myself. I'm not bothering anybody because, I want a clean surface. I'm clearing off the countertops. I'm clearing off my table to make sure that, everything's clean when I infuse. And that's usually when the kid, when the small kids are not putting their germy hands on anything. So, so, I mean, it's super easy. I will admit to not using the actual logging the lots that I use, and just because that's an additional step. But really, the text messaging is probably my favorite feature of the app. Because honestly, if I had to physically go into the app and log, I would probably be maybe 30% less compliant. I don't know how I'm getting that number, but I feel that I log into the app 3 times a year. But I use that text consistently every 10 days. And when I do a bleed, I'd rarely get bleeds. But when I do a bleed, I can text 2 and then usually that's 2 or 3 times a year that I would go into the app. I would go back into the app to tell because my regimen is Adelvion with Benefix as needed. So I'll go into the app to make sure it logs that I use Benefix. But, I don't put in the lots. I know I should, but yeah. I mean, whatever works for you, obviously. A lot of people
feel like he's like making me feel guilty right now with you on here, Matthew.
For the Hemophilia Center to help find out if you're on the right therapy, your logs are important because it is like, hey, how consistent are you, or your bleeds and things of that nature falling around the time that your dose is tapering off. How consistent you are in regimen. Because let's say if they want to raise you in dose. Well, if you're not taking, and this is across the board, not for hemophilia. This is for blood pressure medicines, people with hypertension. I see this often in the retail setting. You're not taking your medicines as described. You go to the doctor's office and like, oh man, my blood pressure is really high. In our case, oh man, I'm still having bleeds, and they want to up your dose. Well, they need to have concrete data, and especially with how expensive our meds are, a lot of times, they're expecting the healthcare professionals, whether it's your hemophilia center or your pharmacy, to have logs to justify that you're sending out this ridiculously expensive medicine to the patient monthly. It's important for them to have logs because they want to make sure that, the pharmacies are doing their part, that they're not wasting medicine, but also the patients aren't wasting the health insurance's money. So, I mean, I haven't run into an occasion where they say, hey, we're going to withhold your medicine if you don't send us the log. But I have had pharmacies like, hey, like if you have a logging, you can send it to us. We'd appreciate it.
It definitely makes a difference when I go in. I know if nothing else is going on when I do that annual visit to the HTC. Yeah. So for me, that's what they want to see. I send it to them, and I would say that I've thought about the application that you guys have a few different times because while I'm there, I'm sending it to them. Like while I'm sitting in front of like Dr. Lessinger, the head hematologist at Tulane, and it would speed up my day and theirs if they had that information faster and sooner. I would say that's something that Steven's told me and what we've talked about before with like Angela, the pharmacist at Tulane, because then they're having to look at it while I'm there during the day, which is going to slow them down. It's going to slow me down. It's not as efficient of a visit as I'd like it to be. And that's one of the reasons why it's not. It's on me. It's not on them because when you have an application like this, it makes it a lot easier for them to have that before I get there. They can look at it like in my file and say, okay, well, here's when it's been, what's been going on. So it's definitely a benefit.
I mean, I have my visit coming up this week, and I know in the email they send you like, hey, reminder, bring your logs. I mean, I would print the logs out and bring it to them, but they already have it. I'm like, you know what? Now I'm just walk in. It makes my life easier.
Yeah, that's what I mean. That's what I'm talking about.
And
It's
yeah,
a lot easier.
but they still send us the email saying to bring our logs. But it is what it is. But no, I mean, that's my personal experience. But with Matthew, I mean, we applaud the product that you put out there. Are y'all making any changes in the software currently, or?
Yeah, so there's a couple of things I kind of want to highlight on the upcoming front related to some of the things you guys said. One, I think definitely reinforcing kind of the value of having the logs in general, right? Ultimately, whether it's paper, whether it's on the Notes app on your phone, whether it's through MicroHealth, there's so much benefit from the insurance coverage, from your own like dosing and optimization. Maybe you've learned through your logs that you can actually extend your dosing window and have to infuse less. That would be great too, right? So all these different kind of things that get powered up by having logs in general is important to us. We've been thinking a lot about how to make logging easier. And I know, for folks like you, Stephen, maybe while it's just a couple of taps, even opening the app itself every time you infuse could be a little bit more friction than you want. So we've actually been kind of mapping out and planning both like a smartwatch app, so that like, you could get a notification, and imagine you could just tap the app right there to say, I dosed or I logged. And then that sends right through to the app, and you don't have to open your phone.
Oh, yeah.
Or also a phone widget, something that you can kind of do from your home screen without needing to go into the app as well, to be able to kind of simplify and reduce the number of steps, right?
Okay,
so
you just sold me. I'm good. I'm good now. You just sold me, Matt. I'm good. That's what I needed right there, is because a lot of it is that I don't want to sit there.
Yeah.
It's me being lazy in that moment. It's like when I finally get home in the evening, or we've been running nonstop. We both have small kids. Yeah. It's like you're going to softball, baseball games. You get home for practice, like you're fried.
But
when get the kids down.
When your phone has 80 apps on it, then you're like, oh, well, what group did I group that one into? So I'm looking through these little small squares that they have 4 pictures on it, and with my 40-some-odd-year-old eyes, it's not getting any easier. So I mean, the widget sounds like a really cool idea, and anything. But the fact of the matter is, we have an app, and I've never questioned on the funding and everything else, but they're really making it a priority to make our lives easier. And how they fund that, I don't know, but apparently through selling data. But But I mean, it's amazing because, I mean, some people, I'm not going to name names, going to have an app where you use it on a PDA that was never promised, and they never made any updates to it for 20 years. And this one just making it almost like part of your life. It's almost like Apple, right? So Apple kind of, I'm on an iPad, you're on a MacBook, I have an iPhone on it, I got the watch. It kind of creeps into your life. It kind of gets in every aspect of your life. And now you're saying like, oh, well, we're going to have a widget, and we're going to be on this thing. We're going to have a watch app. I mean, it's really creeping its way. Like, okay, you're going to log us one way or another, whether it's on your laptop, on your phone, on your watch. I mean, it's really, it made almost like an, what do they call it, ecosystem.
Yeah, but it is ultimately the convenience of me. It's on me as the patient to hit the app, go through the process, to make it easier on myself and the physicians later on. But yeah, it's just down to me being lazy. But I like anything that what you're talking about. You're speaking my language, because it's something that I know I deal with. I'm fried. And we already don't want to infuse. You don't want to have to stick yourself and then you'd be more uncomfortable for a few hours before if you do have a bleed. So anything that we can do to really, because the reason we're here is just to hopefully get good information out to someone out there to improve their quality of life, or give them something that will benefit them, which is, again, why we're talking to you, because I hadn't used the app. Steven has. He's like the living commercial for you guys with me. So, and it makes sense. What he's talking about is smart, but Steven's smarter than I am. I'm slow. So that's just part of the process. No, I'm just slower to process certain things. And when it comes to time at home with my family, anything that I can do to get a few extra minutes with them is always a priority over everything else for me. So,
but you mentioned a good thing, that you're tired. A lot of us, I think that's the case of inconsistent logs. We're tired, and the last thing we want to do is stick ourselves. So when we do it, we're even more tired when it's
Right.
done. And
Yeah.
I mean, it's less of an issue with me because my factor is so infrequent, every 10 days. But for you, you're doing it every 3 days, but maybe someone with severe A that's doing it every day to every 12 hours, maybe.
Yeah.
I mean, that's
Think about an
that's
inhibitor. So
it,
like,
yeah.
you
I
got,
mean, but to think about how I wouldn't call it, yeah, you can say cumbersome. It's oh man, not only do I have to stick myself every 12 hours and wherever I am, I have to like keep a log of these lot numbers and whatnot. But if you just made it easy, hey, I'm sticking myself, and as I'm doing it, I'm gonna just hurry up and click one on my cell phone.
I mean, how many friends do we have though that even if they're older, married, not married, or don't have kids, life's overwhelming.
Yeah.
And there's so many different things with any chronic disorder that is taking up a lot of your day, or it's not making you able to do the things that you want to do, whether it's a full-time job or, we have a lot of friends that are going through things where, especially lower extremity, where if it's a weight-bearing leg, so you got gravity, basically you're putting pressure on something that's already bleeding internally, is damaging to the joint. So they're on disability. They don't want to be, everybody that I know that's hemophiliac, they don't want to be there. It's not a space that they want to be in. It's frustrating. So I'm saying all those things add up mentally and emotionally, and a lot of them are just fried. But I know a lot of those people that are still using this application.
Yeah, but I'm saying it also makes sense. Like you said, it's if you have low extremity pain and you're doing paper logs, if your ankle's hurting, the last thing you want to do is roam around the house looking for your logs.
Right.
Because let's be honest, I'm not the neatest person in the world. It would probably take me a minute. I've been trying to find a flashlight for the last 2 days. So, it's going to be one of those things where at the end of the day is in anything, efficiency is key. And when it comes to healthcare logging, this is the most efficient thing I've found.
Yeah.
But efficiency matters so much in everything because you want to plan your day so you optimize your time. You want to use a pen that, maybe like myself with the elbow problems, I've used a pen that clicks, because it's more efficient to use it because I use it, but it also hurts me less when I'm not having to pull a cap off. But it's if we find ways to become more efficient, to make better use of our time, and this is just another way to make better use of your time.
Yeah.
Yeah.
No, it's definitely more efficient. So I'm leaning in now. I like the ability to be able to have something pop up on my screen. I can just touch it as opposed to me opening up an app. I don't know what that is in me that makes me not want to do that, but it has definitely been a hindrance for me in doing this process.
Yeah. But, Matthew, when we talk about these logs and everything, but when we use the app, what do the healthcare providers see when we submit or bleeds?
Yeah, I'd actually be happy to share my screen and show you guys a little kind of peek behind the hood of what the healthcare professional side might look like. So if you guys don't mind me sharing my screen again, I'll pull that up right now.
Yeah, thank you.
Can you all see that?
Yes.
Perfect. So now, calling back to what we saw earlier, we're in the mind of Michael Scott here, our test HCP in the top right, and we're looking at the web dashboard, which is really kind of that other leg of the platform, right? So as we saw in the app, you can connect really easily to different healthcare professionals. Actually, we recently added this new QR code feature. So instead of needing to search up for your HCP by name, they can give you a brochure or send you a photo of their personal QR code, and you can scan it directly in the app, and that'll get you instantly connected to them once you submit your consent. And on the HCP side, kind of the home screen is really about recent activity. So for all the different, MicroHealth members that a healthcare professional might be connected to, at a glance, they can see, which new users might have had a bleed. So we see that there's one user who had a follow-up bleed on their back over a couple of weeks. And then Matthew April, in the back of April, had a spontaneous bleed in his left elbow. So we get kind of this immediate dashboard of triage, okay, what should I be aware of? What's most critical? You can also see, what the dosage kind of adherence has been. We have a bunch of test users here, but, you can see of all the different scheduled doses, how many doses were taken, how many were skipped among your users, in case you want to go in and follow up with them as a healthcare professional. And then most powerfully, we can go take a double click and actually look at what does it look like to view an individual MicroHealth user's information. So if I go in and click Learn More there, you can see we're over here in Matthew April's individual page. So we get that same calendar view that we saw on the app side, where we can see all the different dots that correspond to logs that were taken or not. So we get a bunch of information here. We have a new bleeds tab that helps the healthcare professional actually see at a glance all the different information about the bleeds. So over all time or on a year-to-year basis, of all the bleeds that the member logged, how many were due to injury or due to a spontaneous reason or related to activity, and then what was the actual distribution of where the bleeds occurred. So for this user, most of the bleeds were in the left elbow. We know that's probably a target joint. We can follow up there. And then we also have, in addition to that calendar view, kind of this full events log. So on all the days that the user logged, what did they log and exactly when did they? Did they leave notes about it? Did they attach photos related to those logs? This can help us really drill into that individual level, right? And get really useful information about all the activity.
Yeah.
And then the last thing I'll highlight is on the treatment side. So, if the dose does update, maybe my dosing schedule changes, and as a healthcare provider, I want to remind my patient of the new schedule and make sure that their MicroHealth app is as updated as possible. I can actually go in here. I can see, what is the regular regimen that the patient's on, what is their personal information, and if I want to request a change, I can send basically a nudge over to the patient. So let's say Matthew's dosage of this generic medication has actually gone down. It was 163 before, and now it's actually 120. As a professional, I can go in here. I can recommend the new dosage. I can change the frequency of the dosing if I want. And I can even say, here's actually the next dose date. I can go in here, and I can go ahead and request changes. And obviously, the patient, the member is at the core of it, right? So if I go in and request changes, it's not going to change the app automatically for the patient. The patient gets a chance to review those changes. If they agree and if everything looks good, they can go ahead and hit approve in the app, and then the changes will go through. But this is just another way to make things easier. Let's say you had your doctor's appointment, you've talked about a dosing change, but maybe you lost a piece of paper that was written down on. Maybe you could just use an extra reminder. This function and this feature is really just to help make things a little bit more easier and to give the HCP a way to kind of communicate with you directly through those app settings.
Nice.
Yeah, that's good to know. I have a question. When I do a log and I actually use the app, especially for bleeds, that's usually the only time I use the app, there is a note section. So does that note get transmitted to the healthcare team?
Yeah, it totally does. So in the events log here, if there's a note attached to a log, it'll actually show up right here next to the wording of the dosage. And that's true for not only infusions, but also bleeds as well. On bleeds, you can also attach a photo. And so actually, I'll go back to this test user, Jesus, who's our test dependent, who's taking a dependent account. Actually, if you hover over here, you'll see that the photo that was associated with that bleed and the free text note shows up here right in the dashboard as well.
That's neat.
So there's all that information that gets transmitted really in real time between the patient and the provider.
And that's live right now, the photo. Really? I had no idea.
Neither did I. I've never seen it before.
So we have users who've been on the app for many, many years. And as you go into their logs and their PDF, you can actually go back and see, photos related to bleeds dating all the way back to, 2015, if they've been logging that long.
Wow.
And, the reason why I bring up the notes early is this, and a lot of people, especially hemophiliacs, when you go to your appointment, a lot of times our appointment's only once a year. And it's kind of tough to remember all the different details of why you infused when you had a bleed a year later. So for me, myself, I'll put in the notes like, hey, I received the bleed in my back or my right ankle. It was spontaneous or was caused by trauma. If it was caused by trauma, this is what I did. I picked up something that was way too heavy for myself and tweaked it, thrown it into the back of my truck. And I'll just detail it as much as possible, whether it was sharp pain, whether it's swelling, whether it's bruising. And that way, when I do see my provider a year later, I'm like, yeah, well, it's like, oh, well, I noticed that you've been having more bleeds than normal. Well, if you look at them, it's like, oh, well, it's actually caused by trauma. That's not that bad because, like we're going to injure ourselves. Let's say you get 4 bleeds caused by trauma. It's a lot better than having 4 spontaneous bleeds, because then it's like, hey, if you have 4 spontaneous bleeds, maybe your regimen's not optimal.
Yeah.
But we're all gonna, if you have any sort of active lifestyle, you're gonna, you can't help it if you're running and you stub your toe on something hard on a concrete corner or something. We're gonna have those issues, and I think that the notes section is important for people to take advantage of.
I like the photo.
Yeah.
To me, it's a great way to be able to say, here, this is actually what's going on.
Yeah.
It's something that, and I've heard that you guys did that in the past from someone else, but I hadn't seen it until you just showed us. So I'm glad you were sharing the screen, because that actually helps me get a better idea of what it comes across like. And you said that's in real time. So I take a photograph basically through the app and then download it through, and that's going to go to the provider directly where they can view that.
Yeah, on the patient side, once you log your bleed in the app, and you can include a photo or you include free text with that bleed log, that gets automatically uploaded in our platform to this HCP view that we're looking at.
Wow, that's great.
Like we mentioned earlier, there's different settings that providers can use depending on how they want to use the platform. But for bleeds in particular, they can be notified right here, as you can see on the screen, either immediately when a bleed happens. They can actually choose whether they want to receive the notification through an email or even through a text message.
Oh, wow.
So we have a mix of those. But let's say that bleeds can happen off hours, and you don't want to overcommit to immediate reporting on the provider side. They can also choose to get notified either on a daily basis. So at the end of the day, we'll tell them about all the bleeds that were reported in the platform that day, or even on a weekly basis. So every week you can get a summary of all the bleeds that happened if you want to follow up with those users.
Yeah, because
great.
previously he's been sending me pictures of the bleeds. So,
well, you'll be like, you're like, oh, really? Let me see that. What does that
Your
look?
knee looks like a grapefruit. I think you should call the HTC.
Like, nah, that's normal.
Yeah, so it's interesting. I mean, I think that's great. Most of the time mine won't really show as much because it's micro bleeds and things of that nature. But the fact of the matter is, it's the more data can't hurt, right? More data will allow for better assessments. It'll allow for a better outcomes.
Yeah.
So that's gonna. I mean, I think your app's moving in the right direction. I've learned new things today myself, so I think
definitely did.
It's a great product. You keep our information secure. You've already told us about that, about how you have the trust center and we control where our data goes. You have the healthcare professionals can see what's going on with our health, with our infusions. There's so many different things that we've touched on today. I mean, really, what's the future of MicroHealth?
Matthew, what do you get excited about when you're looking at what you're working on right now? In the next couple of minutes.
Great question. So obviously we talked a little bit about, making the app easier to use, right? And having these different entry points, whether it's your phone, whether it's your watch, whether it's a widget. So that's really one big exciting thing for me. I think the other really exciting thing for our entire team is thinking about, where hemophilia is going in general, right? We know there's new medications coming up, new paradigms, longer half-lives, subcutaneous versus IV. And, hopefully overall, the effect of that is that it becomes easier and easier to manage, the disease. There are fewer and fewer bleeds in general. But at the same time, as with any rare disease, I think it's really important to keep contributing to research and to really good decision-making, right? Mm-hmm. We want to make sure that every person who has hemophilia, regardless of the HTC they're at, and long-term, regardless of where they are in the world, has access to really, really good quality care.
Absolutely.
Really, really good decision-making, and is empowered in working with their provider to find the right medication that works for them on the right dosing schedule that works for them, right?
Yeah.
So I think continuing to support overall research and registries where we can is one really big thing. On the kind of partnership side, that's where we're really excited to kind of continue growing too, is continuing to use the platform for not only day-to-day management, but clinical research, medical research, investigations around medications or dosing schedules and optimization. And then kind of lastly, as kind of the last piece of the puzzle, really kind of leading to a world where folks don't really have to experience bleeds, where folks don't have to experience as much pain.
Yeah.
And I think that's, where the entire community is trying to work towards, right?
Yeah.
But I think we all have important roles to play in that. As a technology company, we have the privilege and the honor of kind of working with patients and providers to help make that a reality too. So that's kind of the long-term vision. I'm sure that's something.
That's great. Matthew, thank you so much for taking the time, but we know you're busy. So when we found out we could grab you, we'll fly you down next time. So
that would be great.
Thank you.
And this is awesome too. You guys have a great platform and doing really important work too around education and exposure. So just happy to spend some time with y'all.
Well, we appreciate everything that you've told us, and I can attest to you how great the app is. I was gonna throw out there, are you gonna venture out to other disease states? Because I'm sure there's other people that can take advantage of some sort of reminder like this, whether they're on, these new GLP-1s that you got to stick yourself weekly and they need a reminder of it, or just anything.
Well, even talking about just the gene therapy, I know that those people are monitored so closely from a day-to-day basis. I can't imagine we could deep dive into that for a long time, but I'm sure that this application, I keep thinking about it because talking to people that have gone through that process, there are so many details that need to be given so often that I would think, as opposed to trying to find different ways to connect with that group that's actually done the infusion and then also with the manufacturer, it'd be a great way to get information back and forth to keep them up to date on a daily basis.
Yeah. Maybe this will be I'm not saying y'all going to replace my chart, but I mean, it can stand aside with one another. But no, thank you, Matthew, for joining us today. We appreciate everything you've been able to share with us, and you have a quality product, and that's what we're all about, is having quality products and quality education to patients. So thank you for everything that you're doing on your part, and we're glad that we can bring some more awareness to your product.
Yeah, you sold me, Matthew. I'm gonna jump on there. So Steven's work can come to a close. You close the deal for him, so he can thank you for that later. Appreciate it, bud. Have a good day, man. We'll bug you soon.
Yeah.
All right, thank you, man.
Thank you so much, guys. Appreciate it.
Bye-bye.